place matters, community matters. And we've learned that health happens in community.
And the more we have a collective approach, the bigger the impact we can have.
We want to be working on the root cause of the issue to doing social and environmental change.
We, the people, make up the systems that we've created.
If you want to make progress, you need to work together.
It takes a lot of really capable and driven leaders.
The fellowship are pastors, people who are running food banks, the school district, the city, the business community, the hospital system, the museum and arts community.
What's exciting about Allentown is the commitment to grassroots, people-oriented work.
Getting to laugh together, break bread together, and really get to know each other.
10 years ago, the Poole Fellowship for Health began to bring community leaders together. I'm Samantha Schock, the Executive Director of the Leonard Parker Poole Institute for Health. The Poole Fellowship for Health recognized that all communities face complex problems. Complex social issues like poverty, mental health, and human trafficking require a whole community response. By providing time and training, the fellowship builds social capital and provides nonprofit and government leaders with a new skill set and common language. The community is made up of people with individual stories. But when people come together, a new story unfolds. The Poole Fellowship for Health has had an influence on healing through art, youth mentoring, ending human trafficking, and community building. We're going to share just a few stories about how collaboration can change the world. What happens when you create conditions for an artist, a mental health provider, and the director of the art museum to connect? Chloe, Tommy, and Max wrote a new script as they brought together the healing power of art as a means to address mental health challenges.
Art from the Heart is a collaboration with the Allentown Art Museum and Valley Health Partners. Came out of a lunch conversation with Max. We were talking about pediatric mental health in particular and how we were having difficulty with engaging young folks in seeking psychotherapy and trying to engage families in an area that's highly stigmatized. And so we started talking about the value of art therapy and just simply engaging in that creative outlet, how important that is. For youth in particular, I could see the gears turning and he said, well, we have the space, we have the people, we have the materials, let's make this happen. And not more than 2 or 3 months later, we were able to set up a program that now we've had 5 events. The children themselves enjoyed the experience. It's just phenomenal. Connecting them not only to Allentown, to learn what's at the art museum, to learn that this is now free, but to have that therapeutic outlet as well. It's just an incredible experience for everyone.
Before the cohort, we really didn't have those outlets to create those relationships and foster that programming. And so to be able to just come out of a lunch conversation with you, Tommy, and a few months later have this engagement with those children and their families and the counselors at Valley Health Partners was just amazing. And so to continue to grow it moving forward is really exciting.
Restoring Petals is a super separate project, but luckily Max and I have been able to connect. It has been a huge blessing to be able to do this work at the Allentown Art Museum. And a lot of what Restoring Petal does is addressing the COVID piece. We went through this mass moment of being in a pause. How do we heal from that? How do we grow from that? Thousands of folks have died from COVID. What does that mean? And so Restoring Petals was really a processing space. I was able to connect other fellows to the space, and then we were able to talk more about art and how it fits into every part of the work that we do. And it's a part of healing and it's a part of our health to be connected to art spaces.
Yeah, I think the restorative possibilities of art and art making, I've appreciated them for some time, but I think these 2 programs in particular and showed the ways that we can reach across these seemingly isolated communities and have a real positive impact. Improving equity and expanding access is, I think, what we're all about. And I think Restoring Petals really showed not just the therapeutic restorative possibilities, but also just the way it can speak to and inspire people who might not otherwise think about art in those terms, let alone come into the art museum and see your incredible exhibition.
even though our programs were not formally connected, the themes are the same, addressing the impact that COVID has had on the community's mental health and identifying tangible ways that we can connect them to these therapeutic outlets. I think that's just a testament to what the fellowship really seeks to do in terms of connecting all of us.
It is so heartening to think about the fact that a community has really figured out a process of developing leadership annually that adds to a compendium of people who are working in the not-for-profit field.
I think the best part about the fellowship is the fact that you're able to network with other organizations and other like-minded people. Information is given, it's so detailed, and all of the workshops are definitely something that is needed in order for us to build our character as leaders.
What happens when you bring together nonprofits with similar visions and give busy executives time to listen and learn from one another? A new picture develops with remarkable outcomes when Bill and Sue collaborate.
So we actually have 2 barbers and 2 hairstylists that are cutting hair for us, and all of our people have appointments set up so that they can get their hair cut. And then we have book bags that we're giving out. You get your hair cut. Looks good.
Like a new man.
Excuse me. How are you today?
Okay.
So when you think about young people and different things that they're dealing with, mental health is one of those things, anxiety, depression. Our young people have a person that they can talk to about whatever they're feeling and whatever emotions they're dealing with, whatever's happening at school or at home. It's just an opportunity for them to have that support, and that's because of our partnership with Pine Bark.
So actually it was Bill that approached me and said there was an opportunity that, I don't know if you want to give the history, but it came up in a communities in practice, and Bill was like, you want to have a conversation? I said, sure, let's talk.
Which is a perfect example of how this stuff works, right? So Pine Brook and Family Answers had for years been running a ComPeer program, which is a way to use the power of friendship to help break through the stigma and isolation of mental illness. And we pair volunteers with adults that have chronic persistent mental illness. And when I used to describe that program to people, it used to be like, well, it's just like Big Brothers Big Sisters, only it's for adults. And so I was using your brand, and people understood it, and they know what you do. But this grant opportunity came along to expand that type of work to youth. And I sort of said, why should we start a new youth mentorship program when we already have a great agency doing the same thing? Youth mentorship. We knew behavioral health and trying to keep kids out of the criminal justice system. And so we partnered to get it done rather than have me duplicate something that another organization was already doing.
Yeah, and so what I would add to it is it's been great to have the richness. We had your staff come over and train our staff on trauma-informed practices. Plus you helped us identify some kiddos that really could benefit from our mentoring services.
Yeah, we've done a lot of mutual referral back and forth. And I think the outcomes have been tremendous. Like the kids that have been through the program, I don't think we've seen criminal justice involvement in these kids, and there's been a fair amount of them.
Absolutely. And now more than ever with COVID, the mental health crisis that our young people are facing, it's just so helpful to be able to provide mentors for them.
You were cohort 1, so you go first.
I was cohort 1. Actually, the interesting thing was I had just started as a CEO and was in the inaugural class. And so it was really an amazing time as a leader to actually learn from other leaders. And really the big takeaway that I took from the experience was not creating programs for the community, but with the community.
We weren't always that collaborative and open. The whole movement of collective impact, I think, changed the way we as human service providers work with each other and improved it tremendously. And the fellowship was a big piece of that. One of the catchphrases, I don't know whether it's in yours, but we heard a lot, was that change happens at the speed of trust. And we really had a built-in level of trust with each other as we were going into this collaboration because of the groundwork that the fellowship laid.
Not one program is going to be the solution. So if we work together, on something like mental health, You need way more providers. So how do we layer and really support the families and the youth and the community at large with the collective impact and the work that we can do together?
Yep. Collective impact, when we first started using that language now 10 or more years ago, I was very hopeful that it wouldn't be one of those fads, that because it makes so much sense for us to have common language, to be able to have common goals that we're trying to achieve. And the fellowship has really contributed to keeping this rolling, having cohorts continue, having communities of practice. It's keeping the dialogue and the values and the practice of collective impact alive and well. I'm just really grateful that the people at Pool really had the vision to get this started, and the time and effort that Pool put into making this a success really can't be understated. They've just done an amazing thing with this.
Yeah, I agree. I mean, there's nothing else I would add other than thank you. I'm immensely appreciative of what I learned as a new CEO. I mean, that on the job training that you got and new language and relationships have been really invaluable.
The whole goal is to take what we're learning through the fellowship and apply it to real world problems. And so oftentimes we're using the frameworks, the tools, the relationships that we've built through the fellowship to actually have an impact in that community.
Being a part of the Pool Fellowship experience was just one of the best professional development experiences of my life.
Sadly, human trafficking is a serious issue in the Lehigh Valley and requires a whole community response. Lane, Nani, and Carol were all serving the same group of individuals. They were given the opportunity to think creatively about how they were each contributing to the solution, and they wrote a new chapter using a common language.
You know, from my world, being the drug and alcohol administrator, I always looked for pockets of the population or the targets of the population that were impacted by a substance use disorder. And whether it was, related to crime rate, whether it was related to the food service industry. And as those conversations began, it really began to morph into survivors of trafficking and the impact that substance use disorder has specifically on that population, and then what limits that population in getting help.
For us, we were providing health care for sex-trafficked women, which eventually became a home that Bloom assumed the care of. And I didn't know what to do. Our team, while they provided medical care, they also worked on getting insurance for our patients. And so we would have patients, we'd take them to a local, substance use rehabilitation place, and they would show up without insurance. And while it was in process, it still wasn't going to get them the treatment that they needed. And so it was like everybody had Lane on the hotline. And so we would call Lane and say, we've got so-and-so, they need treatment. And he's like, okay, take care of it. And also understanding that a home that was managing to care for women of trafficking, they didn't have the medical staff there. It was a lot of volunteers at the time, and it was really scary to manage folks that had substance use without medication. And so that was the first time that we started to have people that we could call on. That's a huge collaboration for us, is actually tying in the home with the county, with our patients. For me, that was kind of what I think of for sure.
Having access to street medicine, you were talking about Lane having his phone number, we have your phone number. And as probably challenging as that was when you got so many phone calls, but I think it was this lifeline to someone that could bridge a medication when someone came in, and knowing that we had even access to some of the mental health support that you were giving, not just the medical support, and having that to bridge that gap until we could get an appointment. People that were willing to exit a very, very dangerous experience and wanted to be safe. And that really, we were elevating the safety in the home because of that collaboration.
So when I started kind of jumping up and down at the hospital about human trafficking, it was the timing. I went from having one special agent from the Department of Homeland Security. Now there's 7 agents in this valley that have an entire floor. And so to go over 7 years to see it, not only is the community aware and feeling good that we actually have great resources, but I see the community wanting to get involved. We have human trafficking in our community, but there's some really great tools and really great partners that are doing good work here. So I feel like there's some empowering with that.
You have a system, you had a system, I had a system we all worked in. And we had this overlap of patients, clients that we never knew overlapped because the database that I used didn't talk to yours, which didn't talk to yours. And if it wasn't for an organization like the Fellowship who would bring these community-based agencies and groups together, and the more you could talk to them and more you can interact and more you can learn together, our systems were interacting. Before the Fellowship, I never would have thought to call street medicine.
When I started the work with street medicine and then began the collaborative, it was really very much siloed. And I think that systems change really made a huge difference to actually affect the same patients. And so I think, to your point, that was a big aha for me in this collaborative work.
The Fellowship has given me some courage that maybe I didn't have before. I mean, it certainly has given me tools as a professional and language that has helped me communicate a little bit more with some of the partners that we need to. And then going through the Fellowship was just kind of this next right thing happening to open those doors to really advance this work. And in the past, I thought that someone would sit better in my seat leading an organization that was providing restorative care to victims. I now have a front row seat to some of the most remarkable transformation stories, and we're seeing the survivors are getting better. They're taking their lives back, and I think they're going to sit in my seat one day and really transform the way we disrupt trafficking here in the Lehigh Valley.
I was so focused within the 4 walls of the health system, and the Fellowship was really my first exposure to community partners and what's happening out in our community and building those connections that I have until this very day.
Being at the cohort showed me that it didn't matter if I didn't have a doctor in front of my name, I was still a valued member of the team and that I had something to bring to the table.
Franklin Park is a small neighborhood in Allentown and is a great example of place-based collaboration. Darian, Deirdre, Sherry, and many others are helping to transform Franklin Park. They find harmony as they put community above their individual organizations. The work in Franklin Park takes collaboration to the next level.
Welcome to Franklin Park. Here it is right here. This is the park in the center of the community, but the neighborhood Franklin Park actually goes from 12th Street to 15th Street and from Gordon to Hamilton. That's considered the Franklin Park community.
And what Cohesion does in the Franklin Park community, we facilitate a monthly meeting within Franklin Park community, and we just create conversation and connection. Connection supports cooperation, cooperation empowers collaboration, and collaboration is the way forward. And we're always trying to move that dial from residents to neighbor. That's where the togetherness comes in. What I really enjoyed about the Fellowship is they were teaching us how to do holistic community development. And that entails data, how do you tell a story, what does it look like to engage underestimated communities, working with systems. It really was an educational piece for me. Building a bridge from that to where we're standing today is that building right there happened through the work of collaboration. Nonprofits working together, organizations committed to the Franklin Park community working together, and we are solving problems together. What would Franklin Park look like in 10 years? Well, that depends on the neighbors and the residents. It doesn't depend on what we say, what we'd like to see in 10 years. We are working in collaboration with the residents and the neighbors to see what they want. Leonard Parker Poole Institute for Health is the quarterback for this work we're doing in Franklin Park. And they brought all of us together to say, hey, let's do this together.
RCI moved into the Franklin Park neighborhood a little over 6 years ago at this point, I want to say. So we were in that neighborhood when I was part of the Fellowship. That initial collaboration with Community Bike Works connected out to our long-standing work with Street Medicine and Valley Health Partners, and then started to connect out further. And that's how we really came to be connected with Community Services for Children.
What does it mean to look at a neighborhood holistically? What are the pieces that we all play in helping to make this a good and vibrant community for our neighbors?
It's funny that you talk about the name Franklin Park.
Yeah.
As a Head Start program and Community Services for Children operates Head Start in the Lehigh Valley, we've always had classrooms in and around the vicinity of what we now refer to as Franklin Park. And the children go to parks every day, and you would hear them say the Blue Park or the Red Park or the Squirrel Park, and all centered in and around this neighborhood. And between the fellowship, making those connections with Valley Health Partners, especially as we think about children and their health needs, make the connections then to the Allentown Art Museum, which is right up the road, and helping to serve both our children as well as their families, because we are a 2-generation program, recognizing who is in the neighborhood, how do we connect them to the resources that are local. That really brought an eye-opening experience to how many resources are actually located within that area. And at that point in time, really working independently. So to be able to think differently about what is in the neighborhood and how do we connect our children and families to the resources that are there really makes a difference.
Looking back, seeing those early conversations and how they've really grown into this maturing collective effort around the place, the neighborhood that is Franklin Park, and being able to think about what does it mean to establish a home in that neighborhood, to raise kids, to put down roots, to have the kids go to the same school year after year. We have so many of the ingredients to do that really well, right? And now I think we have the relational capital to do that really well, and bringing in some of the organizations that are newer to the fold, like Cohesion, to be able to come in and lead us in that grassroots organizing. It's pretty amazing, I think, when we look back over just a handful of years.
And I think the city's involvement. I mean, to have the partnership of the city working collectively with us and with the resources of the city to bring to the table, I think is amazing as well.
If we were to walk around Franklin Park every day for the next 2 weeks, what we would see is all of those organizations actively out in the community, engaging with the neighbors. So it's, for me, that's part of what makes it so genuine and so promising. When I think about how the fellowship has impacted me as a leader of a nonprofit organization in Allentown, I think about how it has helped me keep the lens wide. So our organization has a specific mission, as does every organization. We're very focused in on relationship and community building. We're very focused in on making sure that all of our neighbors have access to safe, healthy, deeply affordable housing. So that's the nuts and bolts of our work. That work doesn't make any sense unless it's connected out to partners who are working in all of the other pieces of things that we know make life make sense for our neighbors and for our community members. So for me, it's just been a constant learning experience in what does that mean? What does it look like to really be a piece of a puzzle?
And I think the fellowship being the safe place where you can come to say, this is not working out how I thought it was going to work out. And having the grace of the other fellows who are willing to say, well, actually, we're kind of facing something similar. And another fellow who might be saying, well, actually, we're having some success over here. And so folks really willing to share what's working for them and to also provide this space for grace to say, it's okay, we're gonna keep at it. We can provide some additional supports, and we've been there with you.
What we have going in the neighborhood is something really extraordinary, and it's early days, and I'm really excited to see where it goes. But the genuine collaboration, the genuine desire to do what's right and what's best with the neighborhood, with our neighbors in that community, and the network of resources that we're able to bring to that table, I just think it's something really beautiful that's taken root.
In 10 years, we've had nearly 100 fellows and national experts across the country as faculty.
Systems change for me is about thinking about why something is happening. There's a real budding, growing group of people here who are being trained in systems thinking, who are thinking systemically,
Having the amount of commitment to individuals and deep work to build people's capacity and organizational capacity is really impressive. And that sense of place and pride in place is still really present every year that I come back.
I've been so impressed with the individual leaders, the collective efforts, and the constant revitalization that I get to see all over the town.
But really what's going to change neighborhoods and communities is where those different practitioners and investors and mobilizers are working horizontally across all those systems for the sake of a neighborhood and a place. And I'm seeing that happening here, and I think that makes for an exciting decade ahead.
And what we're hoping to see in Allentown is to see all that community engagement turn into real change in health outcomes, life expectancy, educational outcomes, and income mobility.
What's great about meeting a new cohort each year is that they come in not quite sure how to be thinking about collective impact. They get to learn together through a series of interesting topics, which the fellowship team has put together.
Fellowship is about relationships and action, and the investment over the last 10 years has led to deeper relationships and innumerable actions to improve health and quality of life in the region. Our 10th cohort is beginning, and another story is about to be scripted. Every new year brings together fresh ideas, partnerships, and innovative solutions. I know the work that we are doing is making a difference, and the communities we serve have all of the assets they need to be thriving and vibrant communities. And we're just helping to bring it all together.
I think the fellowship is valuable for both our organization at Valley Health Partners and for the City of Allentown.
And I'm positive that this commitment to build leadership and build capacity and have people think in a systems thinking way is going to have great benefit for Allentown and for the region.
Cohort 5.
Cohort 8.
Fellowship.
Cohort 4. I think we're going to be able to advance solutions that truly improve the quality of life in our community.
This is going to be a humbling experience. It takes a lot of really capable and smart and driven leaders, and it reminds them that they still have a lot to learn.
Cohort 9.
Fellowship.
I am in cohort 8.
Community.
Meet people on our day-to-day journey as we come to meetings, but to really have that connection is what I learned at the cohort. Cohort 8.
Cohort 4.
Cohort 4.
Cohort 6.
I just want to say thank you for accepting me as a part of the fellowship. It was such an honor to be a part of it.
Cohort 8.
Cohort 5.
Cohort 2.
So happy 10th anniversary to the Leonard Parker Pool Institute for Health, and to all the fellows, thank you so much for everything you've done over this last 10 years. The next 10 years are going to be even better.
Congratulations to all our fellows on the amazing contributions you have already made and those still to come in the future.
Cohort 10.